So yeah, hi, I'm Libby Haynes. I'm a SPHR funded PhD student. I'm just going to give you an overview of some preliminary results that from my quantitative investigation into associations between working while still at school and the health and wellbeing of 17 to 18-year-olds in the UK. Most employment research focuses on more established adults, so this is a bit of a foray into the unknown. Well, it's certainly unknown to me anyway. So I used data from the DeBeat study for this analysis, which is a study that my supervisor did. She's more interested in sort of diet transitions in early adulthood, but I used that data for this. There were over 1,000 participants included in my analysis. They were all 17 to 18 and still in compulsory education. Around half of them reported that they were engaged in paid employment. I looked at 3 outcomes: their wellbeing score, and that was using the Warwick-Edinburgh mental wellbeing score, their self-reported average sleep duration, and their dietary quality based on scoring their reported food intake against the DASH diet guidelines. I ran multiple regressions to see if there were any associations between these outcomes and working or not working. And for those who were working, I also checked to see if there were any associations with the number of hours they were working per week. I added interaction terms to these models to see if any associations differed based on the socioeconomic status of the participants. And a load of potential confounders were included as covariates. The main headline result is that I didn't find any significant associations between working or not working or work hours on sleep duration, well-being or dietary quality. It looked like there might be a couple of interesting interaction effects with socioeconomic status measures, but after diving down into it a bit deeper, that looked like it was probably just noise. But hopefully those kind of results will reassure any anxious parents who are worried about how employment might affect their teenagers. And while that concludes the basic story of my analysis, there was a second kind of narrative that popped up by itself during this project, and it really demanded attention. I planned my analysis based on the assumption that teenagers from lower socioeconomic backgrounds would be more likely to be engaged in paid employment simply out of necessity. However, when I produced the basic descriptive statistics, I noticed I had it backwards. The young adults in this sample are more likely to report that they are in paid employment if they have a higher socioeconomic and less minoritized background. Specifically, employed participants are less likely to have been eligible for free school meals, they're more likely to be white, and they're more likely to be from less deprived areas. That's according to the index of multiple deprivation. The bar chart there shows that with the lower number is kind of more deprived, going up to less deprived. I do have some ideas about why this might be, but I'm very interested in anyone's opinions on this because this did come as a surprise. This isn't something that I have properly evaluated because that's outside of the scope of my project. This is just descriptive statistics, so I haven't controlled for anything, but it's still unexpected and a bit weird.
And we know Libby, just to say your time is up. So given that this is now time for questions, I guess if it's okay for you to wrap up, we could see if anyone wants to immediately comment on that in response to your invitation.
Can I have a sentence?
Yes.
Just please. My feeling is this is just this is just another example of how early inequality starts and how it's perpetuated with implications for health inequality throughout the life course. Thank you.
Thank you.